It is my privilege to introduce the Institute's truly fearless leader, Dr. Shaista Malik. I was going to say, sit tight with me. The list of her accomplishments is long, so it's going to be just a minute. Dr. Malik is talented and drop-dead gorgeous, and an absolute trailblazer. She inspires others to pursue a transformative vision for healthcare in her capacity as a leader in the following roles: founding executive director of the Susan Samueli Integrative Health Institute, and founding associate vice chancellor for integrative health in the Susan and Henry Samueli College of Health Sciences. She is also the medical director of the UCI Health Preventative Cardiology and Cardiac Rehabilitation Programs. She is also the professor of Department of Medicine Cardiology in UCI School of Medicine. She is the co-director of the Susan Samueli Integrative Health Institute's brand new Integrative and Functional Medicine Fellowship. And if you need your car brakes fixed, she is a certified auto mechanic. That is a true story. Okay. So, as an accomplished researcher, Dr. Malik has received National Institute of Health grants to explore the role of cardiac computerized tomography in people with diabetes, to look at the genetic, protein, and imaging markers of early heart disease, and to investigate the role of acupuncture in treating hypertension. At the national level, Dr. Malik serves on the American Colleges of Cardiology's Cardiovascular Imaging Council, is a standing member of an NIH study section in cardiovascular disease, and is on the American Heart Association's Strategic Focused Research Network Oversight Committee. I'm tired. I am tired. Woo! So, here to speak with us on the heart and brain connection, please join me in welcoming Dr. Shaista Malik.
Thank you, Megan, for that very kind introduction. And good morning, everyone. This is my favorite event of the year, bar none, and so it is so great to have you all here. So I'm going to be talking about the connection between heart health and brain health. Let's see, let me just find the clicker here. So when it comes to longevity, women do live longer than men, but which is great news. But our reproductive lives are half of that of men. And so in our second half of our lives, we face a list of silent diseases. We get vague and often varied symptoms starting in our 30s when we start to face perimenopause. In fact, according to the NIH, 85% of women experience what's referred to as menopausal symptoms. And those are mood irritability, hair loss and thinning, heart palpitations, sleepless nights, weight gain, and the list goes on. And just think, in medical school, menopause is covered for less than an hour. And so we kind of gloss over it. So let's take a closer look at what the implications of loss of reproductive hormones can have, with a focus on recent findings on heart and brain health, and discover why an integrative health approach is the solution. So the consequences of hormone imbalance can start in the 30s, where weight redistribution, changes in lean body mass, and that has a direct effect on metabolism, causing things like insulin resistance, cholesterol increasing, inflammation increasing, and that's a setup for risk for heart disease and neurological disease. Heart disease is still the #1 killer of women, affecting 44% of women. And the vasomotor symptoms of menopause, like hot flashes and night sweats, are actually a risk for heart disease and for dementia down the road. The other thing that kind of pops up around menopause is an increased incidence of hypertension. Decreasing estrogen can also impact brain health. Lisa Mosconi, who directs the Women's Brain Center at Weill Cornell Medical Center, studies brain images of women during menopause and finds that a lot of the changes during menopause resemble the changes right before onset of Alzheimer's disease. But not to alarm you, 80% of women go through menopause and those changes stabilize. But in 20% of women, dementia will result. And Alzheimer's disease, which is the highest and most prevalent form of dementia in the US, 2 out of 3 Alzheimer's patients are women. But can anything be done to prevent dementia? And so this question has not been fully answered, but there are many studies that now pinpoint what are some risk factors for dementia. Interestingly, you see a lot of overlap between those risk factors for dementia as you do for heart disease. And to understand the impact of these risk factors and preventing these risk factors, we use a statistic called the preventable attributable risk fraction. And so here we see the top 3 risk factors: hypertension, obesity, and physical inactivity. If you were to set those to an optimal level, 20%, that's on that y-axis, 20% of dementia could be reduced by reducing each of those. Is cardiovascular disease preventable? The answer is absolutely yes. The evidence shows, and that's why I love studying heart disease, the evidence shows that 80% of heart disease is preventable. If we, in this graph, looking again at the risk factors for heart disease, you can see the women in purple and the men in black. If we were to wave a magic wand and make high blood pressure go away, 30% of heart disease in women could be prevented. And so this brings us to the central role of high blood pressure in both heart disease and brain health. So my favorite part of the body is the arteries. Of course, part of that is because I'm a cardiologist, and I have NIH funding in studying arterial disease. But really and truly, arteries are magnificent. They cover us from head to toe in this beautiful lattice work. They bathe each cell and organ with nutrients and oxygen. And they can take a beating. Even when damaged and seemingly overburdened with plaque, they can be resilient. They can shake it off and function normally. And what is that normal function? Well, they can go from one size to triple the size when needed, like during exercise. That's like a 3-lane highway going to a 9-lane highway during a SIG alert. I mean, how cool is that? The inner lining of the arteries, the endothelium, is lined with special receptors for estrogen and neurotransmitters, among other substances. And they act together beautifully to orchestrate this amazing arterial function. And so what happens when the artery doesn't function normally, as in hypertension? We now know that brain centers that control blood pressure get stuck in a sympathetic mode. This sympathetic system, or the fight or flight system and the parasympathetic is our rest or relax system, get disordered. And so when the autonomic nervous system is stuck in this fight or flight, it causes the arteries to vasoconstrict, which then causes the kidneys to retain sodium and release other substances, which then creates this vicious cycle of even more vasoconstriction. And over time, those arteries become inflamed and scar down and become stiff. And that's when hypertension results. So these are the root causes, but no current antihypertensive medications address that sympathetic activation, or inflammation for that matter. However, at UCI, my mentor, John Longhurst, and my colleagues discovered a non-pharmacological method, electroacupuncture, that actually reversed that sympathetic activation. So electroacupuncture is simply using very thin acupuncture needles into different acupoints all over the body that overlie nerve bundles. And we send a small electrical impulse through the needle to enhance that nerve stimulation. And so in our current work, our team has extended and looked at what does it look like to not only stimulate the nerves to inhibit that sympathetic response, but also stimulate the nerves to bring up the parasympathetic response to make electroacupuncture and the blood pressure reduction even more powerful. Our initial study targeting only the sympathetic activation resulted in a decrease in blood pressure in 70% of the study participants. But when we took a closer look and looked at the part of the population that was postmenopausal women, the response rate was only 57%. And so we went back to the drawing board and took a look at the literature, at the Chinese literature, and decided to activate acupoints for reproductive organs. Adding these acupoints, or places where, again, we insert the needles, resulted in a response rate of 76%, which was incredible. And the blood pressure reduction we achieved was that of 11 millimeters of mercury, the same as a pharmacological agent. And when we looked at estrogen, in this group of postmenopausal women, we increased estrogen by 92%. Turns out after menopause, the body can still make estrogen at low levels through the adrenal glands. And those acupoints we were stimulating on the abdomen, actually they're triggering an adrenal nerve that enhances then the adrenal function. And so as we're developing the framework of how electroacupuncture works, we're now circling back to the brain and where that autonomic imbalance originates. And so this is our latest data, preliminary data, looking in animal studies on the effect of electroacupuncture back at the cardiovascular centers of the brain. And we're finding that that combination of parasympathetic and sympathetic acupoints is actually decreasing neuroinflammation. So here in that top cell, where you see those orange cells that look like spiders, those are microglia, and those are the brain's inflammatory cells. When they're activated, they send out little projections and they look like spiders. With electroacupuncture, you see fewer of those cells, and now they're not as activated. And so this is pretty amazing because drugs have a hard time crossing the blood-brain barrier. The central nervous system is a protected environment. But stimulating nerves, right, we're using a pathway and bypassing that blood-brain barrier. And that's how we're able to decrease neuroinflammation reliably. And so if we can repeat these results it has implications for the long-standing effects of electroacupuncture. So as you can see, brain health and heart health are very intimately connected. An important contributor of the fight or flight response emanates from the brain, which then results in the cascade of things we were talking about: inflammation, sodium retention, vasoconstriction, vascular stiffening. And so harnessing therapies that can address these root causes can actually then start to reverse the dysfunction. And although I've made many inferences here, there is more proof using newer tests that there is a central role for cardiovascular health in brain health. One of those newer tests is biological age, or the actual age of our cells and organs. And that's something new that we can now assess by looking at epigenome and protein markers that are released with cellular aging and resulting damage. This biological age can be younger or older than your chronological age. And what's really cool about it is that you can change it. You can get biologically younger. And there's now proof of that. There was a study that randomized people to doing an integrative, healthy lifestyle and showed a reversal of biological age in a very short period of time. In this study from Stanford a few months ago that was done on biological aging and published in the journal Nature, nearly 20% of the population has an organ, because by the way, you can tell the biological age of different organs as well. And so 20% of the population had an organ that was older. And this accelerated heart aging predicted Alzheimer's disease progression greater than any current Alzheimer's disease biomarker. Of course, there are integrative health tools that can help us age better. And so they address physical health and mental and emotional health. And when it comes to specifically heart and brain health, the integrative health strategies that we use in our clinic include nutritional counseling. So a heart and brain healthy diet is a whole food diet that includes lots of vegetables, lean protein, it's low glycemic. There's a diet called the MIND diet, which is the Mediterranean diet combined with the DASH diet, which was developed actually. The DASH diet was developed for hypertension. It's low sodium. And it's being now tested for neurodegenerative disease. In terms of exercise, it's the most evidence-based thing currently you can do for brain health. At least 30 minutes of moderate intensity exercise most days of the week, and then 2 to 3 times a week of resistance training. Stress management through mind and body therapies is also very important. Mindfulness, yoga, and now electroacupuncture have evidence for decreasing hypertension. And then, of course, we don't have time to get into medications and supplements, but some supplements that have proof for brain health, heart health include omega-3, magnesium, curcumin, which was studied for mild cognitive impairment, and then hormone replacement therapy. And I put a question mark at HRT. And the reason is that when it comes to HRT, it's currently not recommended for cardiovascular disease or dementia prevention. It's recommended if you have menopausal symptoms that can't be addressed. However, there are studies that are starting to emerge that are starting to make a case for a personalized approach to HRT, meaning that the risks and benefits have to be weighed before making a decision. When it comes to cardiovascular disease prevention, the evidence is showing that timing matters. Early HRT, within a few years of menopause, can actually protect against progression of heart disease. And so on that top panel, that top row, with no hormone replacement therapy, cardiovascular disease or disease in the arteries and the plaque is progressive over age. And so it can continue, but with early HRT, it can be stopped in its tracks. Late HRT really makes no difference. However, potential risks of hormone therapy for women aged younger than 60 include the rare risk of breast cancer with combined estrogen and progesterone therapy, endometrial hyperplasia and endometrial cancer with inadequately opposed estrogen, developing blood clots, and gallbladder disease. Unfortunately, not an easy decision. When started before the age of 60, the follow-up of the large Women's Health Initiative study now shows that HRT reduces all-cause mortality and coronary heart disease in women on HRT. There's been conflicting evidence on HRT and dementia. Earlier studies actually showed that HRT increases dementia. However, this study, published just a few months ago, showed that in those women who have a genetic predisposition to late onset Alzheimer's disease, or the ApoE4 allele, which actually 25% of the population has, there was a benefit of HRT in improving memory, that's in the green bar on the E4 side, and improving brain volume. And I didn't show that data. So in summary, the top 3 things that we can do to prevent dementia and heart disease today is to do regular exercise and healthy diet, as they're both key to all the risk factors that cause heart disease and dementia. Mind-body practices and therapies can alter that sympathetic tone and help balance hormones as well as reduce inflammation. So I now want to pivot to why menopause in the last half of our lives can be a remarkably beautiful time to take care of ourselves so that we can take care of our family and our community. So don't worry if you can't see everything on that chart. This is a taxonomic chart of mammals, and most mammals, so that's in the pink bar, that's their lifespan, they die off after their reproductive lives are over. In the red box are human females, and that black part of that pink bar is the time spent in menopause. Human females are unique in having half of their lifespan be in menopause. The only other mammal that comes even close to having a long menopause is a pilot whale. So you see, in nature, once you're done reproducing and passing on your genes, you're no longer needed. Unless, of course, you're a human female. Also unique to humans is a very long infancy period. And so perhaps women who aren't having their own children have the bandwidth to help others in the community survive and thrive. And so this is the concept behind the grandmother hypothesis. Kristen Hawkes, who's at the University of Utah, studies hunter-gatherer societies like the Hadza people in Tanzania. And she was investigating infant growth and food availability. her team discovered that the calories provided by men with hunting food were not as high as the calories provided by the food foraged by women. Majority of the calories were coming from a vegetable, a tuber, which is found buried deep in the ground and takes enormous effort to dig out. And so the success of a mother in gathering these tubers was correlated with the growth of her child. But once a mom had a second baby, it was the amount of food that the grandmother gathered that was related to infant survival. So grandmothers who were no longer reproductive and bearing children could actually help in gathering resources, food to benefit the family and community survival. And speaking of grandmothers, this is my mom, Farhat. Here's some photos from the 1940s when my mom, and my mom's the tall girl in the back there. When my mom, at the age of 16, had her comfortable life uprooted and was exiled from India, and her family had to seek refuge in Pakistan. Envisioning a more secure future, my mom used education as a way to excel. In fact, she did so well in school that when she took the national exams a few years later in Pakistan, she scored the highest in the country, which resulted not only in a gold medal, but also as the first female Fulbright Fellow to the US, which allowed her to get her PhD in architecture and urban planning. It was my mom's dream to be part of the team that would build her adopted country. And so she looked forward to returning to Pakistan, where she was one of the chief architects and urban planners of the new capital. While she had many happy years in Pakistan, the political climate in the late 70s began to shift, and it became very clear that women's rights were disintegrating. In 1981, shortly after divorcing, she decided the best thing she could do for my brother and I was to start a new life in the US. But the move didn't go as smoothly as planned, and we waited for our green card for 8 long years. During that time, we lived in poverty, and we did whatever it took to survive. We delivered newspapers and recycled cans and bottles to have food to eat. As a result of the enormous pressure my mom had been under, she struggled with hypertension, and we didn't have health insurance, so she had a hard time managing it. However, during that time, she never showed any regret and continued to be incredibly grateful to be in the US. She taught me everything I know about resilience and gratitude and how to savor the little moments in life. Years later, after I had kids, she proudly fulfilled her grandmother role, playing a huge part in both my daughter and son's lives, which allowed me to go through a cardiology fellowship and start my career. Her positive outlook and can-do attitude permeate our house. She loved the second half of her life, even though it was simple and frugal, without the fanfare her illustrious career had afforded her. She was joyful being a grandmother. Seeing the kids grow up, she would tell me every day is better than the last. Despite all the risk factors, she staved off dementia until her late 80s. She's 93 now, and she lives with me, but she struggles to recognize us. But her positive attitude remains. One of the few things she asks me for is a cup of tea. When I make her her tea, she, without fail, takes a sip and always says to me, "This is the best tea ever." Here's to the best day ever. Thank you.